Well, with that story, then we will engage our able panel here on set in regard to the continuing coverage of the coronavirus pandemic, and that was the statement yesterday issued by the Council of Governors Chairperson Wycliffe Oparanya, of course, Governor Kakamega County 037 in the country, who chairs the COG. I'm joined by three able panelists who have an expansive view to give us an upbeat assessment in regard to the coronavirus pandemic in the country. And with regards to, of course, the first two stories we have touched on, with the number so far yesterday confirmed 22 by CS Mutahi Kagwe, and equally the story which has just ended and covered by Kaindo Stefano, who attended the presser yesterday, with regards to the continuing need for the intertwinement between the national and the county administrations in the country. Therefore, let me engage my able panel. From my far right is Professor Alfred Omenya. Good morning. I appreciate your time, Professor. Thank you for coming. Yeah, what a time to have you to get an expert perspective into what's transpiring in the country. And on my immediate right is Dr. Justus Juma, of course, a political party leader of the Justice and Freedom Party in the country. And at the center is equally a doctor. I presume it's not appearing on my rundown, then you can introduce yourself.
Yeah, Dr. Kevin Rombosia from Life Care Hospitals.
All right, and I appreciate your time, all gentlemen. To just start off with you, Professor Alfred Omenya, in regard to the confirmation of the 22 cases in the country, and the sad reality is that the government acknowledges that by end of this month we'll be having, if not more, at least 10,000 cases in the country. Is that an acknowledgement after assessing the situation, or it's a case of instilling fear for Kenyans to self-discipline themselves in the on eve of the dusk to dawn curfew?
Well, I think it is. It really is an acknowledgement. We need to give government, cut government a bit of flack. You know, if these measures that are being put in place by government are not effectively enforced, the numbers can only go up, and that's understandable, really, because if you look at the nature of epidemics, the disease actually spirals and becomes generic, literally out of control, then stabilizes. And for Kenya, we have not reached that stage yet. We are still seeing, little infection that's just growing normally. And yes, there are the possibilities of containing that. But on the other hand, there's actually a possibility of the corona global pandemic becoming an epidemic in Kenya, basically saying the disease can easily get out of control. Yes, I think government is being cautious in this particular bit. Yeah, but also just sharing with people the reality is a common fact. If you do nothing about epidemics or potential epidemics, then they actually become epidemics. They become pandemics.
Okay, before it comes to the Dr. at the center, the question is the government from the onset, I mean, wasting the most critical resource, trust. Right. And Kenyans, of course, expressed concerns about the flight Air China, which landed with 239 passengers. Right. And the Kenyan who showed that was, of course, castigated. Right. And terror-related charges were imposed. And, of course, for a person who has been keeping track of the global war on terror, then that definitely is a self-fulfilled prophecy by the government. But the sad reality is that the virus is here today. Correct. In one case, then, has the government facilitated the spread of the virus in the country because of incompetent state officers?
That is actually... That's true generally, because I think we have a lot of incompetent people in a lot of spaces. On one hand, we actually do have quite a lot of serious human resource that understand how epidemics spread, that understand how economic spread and so on. And my concern even now is that so far you're not seeing a lot of that being used. Mm-hmm. You're not seeing original proactive response. What you're seeing is copy-paste response, and I've got my medical colleagues here who will actually highlight that actually there are factors here in Kenya that may make us, fight the virus in a very different way, but quite effectively. Okay. Yes, so whatever has worked in China, or whatever has worked in Italy, or whatever has failed in Italy may not necessarily, fail here, because the factors are very different. But that requires that government uses the best of the human resource that we have, both from medical perspective, people who understand diseases and how they spread and how they can be contained, and even from an economic perspective, because again, the structure of our economy is radically different from the Western economies, where you can do 100% lockdown, where government can feed people and so on, where you can, you can order food using your e-platform and so on. In Kenya, well, only the president and a few people around him can sustain that type of lifestyle. But this will only move if government realizes that it is time to use the institution and the human resources that have capability to deal with this, not collecting interesting politicians and interesting business people as our response strategy.
And of course, you mentioned that, and then what comes to the fray is the resounding silence of the political leadership in the country when more than 416 members of parliament of the bicameral house generally appear to be definitively silenced in the midst of the crisis. However, we'll come to the economic aspect and unpack what needs to be done, whether we can learn some lessons from Italy as per, of course, the failure by the political leadership of the Prime Minister Giuseppe Conte, whose members of parliament handshaked in public. Later, one of the members of parliament contracted, and then the entire country was full-blown. Dr. at the center, if I may come to you. To borrow the words of the French President Emmanuel Macron, we are in the midst of a war with a pandemic. And in this war, we have deployed our health workers who are the forefront, at the front line. And they yesterday issued a presser saying that we are not given the needed equipment, we are not given the needed protective gears in the country. Therefore, in the midst, as we deploy the boots of the medical doctors on the front line to cushion the country, how do we wrap them up in immunity, at least in reducing cases of them contracting the virus?
Thank you. I think that COVID-19 is here is no longer a question, because it was declared a pandemic, and Kenya being amongst the community of nations, it then puts our populations at risk. So regarding your question on protecting the frontline officers, there's what we refer to as PPEs, personal protective equipment. There has been a lot of concern in terms of our preparations for PPEs. There are a lot of dynamics that are going into this. One clear one is that you can see there's no rational use of PPEs. And again, the public has to be blamed partly for this, because you will see a lot of abuse in terms of mask and non-mask usage, whereas it's critical that some of these are left for healthcare workers, them being at the front line of it, like you rightly said. And again, when you look at, like Prof will tell you, whenever there's a shortage, prices of commodities would go up. And the same is occurring on the same PPEs. You're having a basic commodity as a mask, which used to cost, a surgical mask used to cost around 2 shillings. Now one would go up to 200 shillings. So that tells you that also people are taking advantage of the situation to drive this shortage. But that PPEs should be provided, especially for the frontline workers, is not a question. That has to be done.
All right. Well noted point. But many Kenyans have equally been concerned about the usage of the masks. Before I come to Dr. Juma here, who is more paramount, or at a point of, at an epicenter point, which is more crucial in using the mask than the other?
So first and foremost, again, when you look at public health responses, they're never complex. And one mistake we're making is that we're making it very complex, whereas the basics are usually, basics. So you must then begin to understand what is the role of a mask. A mask essentially is a filter element. So that separates the person from whichever offending agent that is across. And there are different types of masks. There's the surgical mask, and there are the more sophisticated masks, which are referred to as N95 or filtration face pieces. So again, when you look at what the World Health Organization has prescribed, they've given guidelines on rational use of such equipment as masks, whereby in a healthcare setting, those that are doing the screening will require surgical masks. But then when you move further into the system in a hospital setting, you find persons who then are more at risk, what we call aerosol generating procedures. So with this, then they require N95 masks. But now we've flipped the pyramid, whereby I think when I was traveling to Nairobi yesterday, I would see a lot of drivers and piki guys putting on N95 masks. So then what happens is that you're now creating another shortage for those who actually require these masks. And again, when you look at the CDC guidelines, the Center for Disease Control, masks are actually not recommended for people who are well. they're more recommended for persons who are unwell, because like I indicated, this is, a filtration surface. So then if you're unwell, this protects the other people from whatever you're, generating. And again, if you look at what the World Health Organization has said, is that if we overuse PPEs, it has a tendency of getting the public to assume that they are protected and then forgetting the very basic measures, like hand hygiene, respiratory hygiene, which have been shown to be even more important. So that's why I'm saying, as a country, we need to go back to the basics. Stop complicating it, stop inverting the pyramid, and just work with what is prescribed.
Okay, Dr. Juma, if I may come to you, this is not the first time the modern world is experiencing a pandemic of such magnitude. The Spanish influenza 1918, 1919, the swine flu 2009, the SARS and the MERS, which killed equally a considerable number of people, and where China actually learned from in boosting its healthcare system. But besides all that, how do we then perhaps turn our attention, for the government, from the policy-making perspective, turn the attention adequately on the medical personnel in the country and the medical fraternity, which for years complained about inadequate capacity, infrastructure, good working environment, and better pay? Therefore, is this the right time to turn attention on them and perhaps undo the damage done on our medical front in the country post-COVID-19?
It's a very good exposure, especially bringing the, focusing the demand on our health infrastructure, which for a while ago, the things that actually have been coupled around the health ministry. Mostly, those are the areas where we've been blowing corruptions and actually in very high gear. And regarding what is happening, because ironically, the flus you've mentioned, historically they happen during certain elections in the world.
Yeah, presuming the American elections.
Sorry, I didn't mention any country. But by now, I think every system or leadership should be aware and have certain preparedness regarding these calamities, because these are these are global occurrences. And actually, now the fact that we're having scientists in this field, they can also actually break it down for us, because to begin with the actual understanding of the actual flu or the virus itself, because some says is a respiratory deficiency of what? Of the lung.
Right.
And some people are saying it has a dry cough, right, no sputum, right, whereas the usual flu normally have sputum. So some of us also looking at or angling it with biological warfare, which may be initiated by various political dynasties, may be actually what could be victimizing us, unless the doctors bring more clarity in understanding the disease. But that being aside, the contingency measures that are being taken, they are not new. Even globally, the same measures are being taken. And what we needed to have done is to evaluate the measures we've taken. Right. If they're not stopping, right, but they are leading to reoccurrences, correct, then we need to intensify measures to stop it. Because you cannot, to me, I call it fear-mongering. And this, I say boldly, with humility, Bwana CS, you cannot, at this moment, actually put fear on Kenyan citizens. Exactly. The best you could do is inspire them, correct, and set up measures. I know there are paradoxes, as we mentioned. Okay. Set up measures that can help us stop it. Actually, even the number we're having of 81, it is just too much. Those are voters, those are citizens who should be protected by you. Correct. So allowing this to actually report to the same figures that we're talking about, if anything, actually the government should have moved in with proper contingency measures, even if it means feeding people. We are capable of doing this. Right. Look at our budget. Okay.
So we are talking about trillions, but the point is, Daktari, to be specific here, and this is what my question seeks to unearth here and unwrap, is whether in the midst of, we are in the midst of the calamity.
Right.
No doubt about that. After navigating the waters then, will it restore some sense in the leadership of the country to forgo status, to forgo class? Because right now, if, say, leader A is infected, he cannot travel outside the country. It's not a cancer treatment you will seek in New Delhi or in London in the UK or in San Francisco in the United States of America. You will be here along the people who are infected, and you will be quarantined.
Yes.
The point is then, will this perhaps be the point with which they will be instilled with some concern to boost our healthcare system, that if need be, and it's inevitable for another pandemic globally to rise in future, that our healthcare system will be able to withstand the test of time?
Actually, this is a test for the leadership we've been looking for. Unfortunately, as a litmus, it is proving otherwise, because you've just mentioned that all of a sudden all the political leaders have disappeared. There are things that we've been desiring to have: leaders who can fail their citizens, leaders who can sacrifice and serve their citizen. Unfortunately, they sacrifice the citizen.
Right.
Sorry to say, actually, it is very immoral that some other leaders are trying to use this strategy as a charity case to get sources of funding. And these sources and funding, even as we're talking right now, you've heard some people have donated. And yet when you go to the hospital, nurses are still not having proper gears. You're wondering what is going on. The other day I was with the matatu drivers. I was with the Landlords and Tenants Association. I was with the Border Association. And on the ground, these people continue to work. They've even adhered to mitigative measures that the government stood on a pedestal and pronounced.
Correct.
You're telling them to cut down their fares, carry less people, yet you're not cutting down the fuel cost. And these people are not receiving anything from the government whatsoever.
Okay.
And if you look at these cases, actually, it is exposing the type of leadership that we're having. And Kenyans going forward, we need to reconsider the leaders we are looking for, especially who can help us respond critically to moments like this. Those are the leaders who now we should start going for come next election.
All right. And Professor, if I may come to you, not forgetting the line that ended the doctor's statement here in regard to the lack of change in the pump prices in the country, despite oil per barrel price across the world now lessening from $86 to about $2,300, about $23 in the country, and it seems still the same in the country. But all the same, when you hear, we played the story of the Council of Governors yesterday, chaired by Wycliffe Oparanya, the governor of Kakamega County, and he said that there's need for more cooperated response from the national government side, and that, of course, alongside of the county administrations in the country. Is it an acknowledgement from the leadership of the country that our health systems cannot withstand? Two, in the event the numbers continue to increase, because we are seeing an exponential growth in the number of cases in the country, will it inundate, overstretch, overwhelm our healthcare capacity in the country?
Incidentally, for us as a country, that is that's a tragedy. That's what we're worried about. We are really not worried about the disease per se, but we're worried about our total lack of preparedness. You know, when you're talking about less than 300 ICU beds in the country, if we reach, God forbid, if we reach the state that Italy reached, or even where the US has reached and so on, we are doomed. So the biggest fear really is that our infrastructure, including our infrastructure and our human resource, cannot really be able to respond to that level of infection. I was just telling somebody yesterday that the new 22 cases of infection, sorry for playing a devil's advocate, I was asking, who are actually these people? And is it true that there was no infection happening until yesterday, then 22 people got infected? Basically what happened was that of the small group that got tested, 22 tested positive.
That's according to
That's the correct interpretation. That government tested, and the ones who were tested were only the ones in quarantine. It was not random testing. So I'm just using that as an example. That even our so-called 80, let's be honest, it's not that 80 people are infected in Kenya.
Okay.
80 people have been tested amongst a small group
who have been
that have been quarantined. and that is the figure we're getting out there. It's quite possible that a lot more people are infected in the country. I'm using that just as an example of how ill-prepared we are to deal with this. Even at the level of testing, we can't test. So, I mean, if you had COVID now, you may not even know because you're not under quarantine. Yeah, but now you can imagine, I mean, a situation where our current healthcare system that is on its knees gets inundated with these new cases. I think, again, playing the devil's advocate, I think the government is not very keen on doing widespread testing because that's a way of keeping those people outside of the healthcare system.
Okay.
Immediately we confirm that the numbers are bigger than there, and then these people have to be then, taken into the healthcare system. The healthcare system will actually collapse. And that's an indictment. It is an indictment on us because we've had all these opportunity with devolution, to expand our healthcare system. And as Daktari said, this is one of the places where we've had so much corruption going on from national government level. Health is so fundamental, and food security and so on. You'd imagine that any sensible country would then put this as something that everybody needs in the country. In our case, we've not had it at all.
Okay, well noted point, because equally from the governance perspective, what he had, of course, later will expound on that. Galana Kulala project collapsed. Universal healthcare coverage appears to be more or less not so the hope on the horizon, for that matter, for many Kenyans, because not all Kenyans can afford accessible and affordable healthcare services in the country. Manufacturing, we are having capital flight from the Kenyan market to safe havens in Rwanda and Ethiopia. And the other element in the Big Four agenda, that is
housing.
The housing appears to be facing a lot of legal battles in courts in the country. And we'll take the political bit of it on whether we can realize that and Kenyans can benefit in about 3 years' time, mathematically, owing to the time which continues to run out. Dr. If I may come to you, Professor pointed out the aspect of the 81 in Kenya, the total confirmed cases who have been quarantined before testing, meaning there are people out there who can be positive and mingling among the population. Therefore, talk to me about the asymptomatic people who are immune but are carriers of the virus and can explore the entire country. Then what happens in such circumstances?
Yeah, thank you. I'd like to be a bit more optimistic in terms of what the government is doing. And I think I would support what the CS is doing in terms of giving us projections that by the end of April we may have up to 10,000 cases. But remember, he said, this can happen if we remain on the same trajectory and the same behavior that Kenyans are exhibiting. So, and again, when you look at the WHO guidelines, there's one thing that WHO has described, and this is called infodemics, that in the midst of such pandemics or epidemics, there are a lot of rumors that go around. So it's very important for the CS to come to the front and give us the exact picture as it is. So it is not meant to instill fear. Well, in a way it does instill fear, but the most important thing that it does, it communicates the level of risk that we are in as a country. On your question of the asymptomatic nature of COVID, I come from the private sector. Life Care Hospitals is a private tertiary facility.
Okay.
And I'll give you a case that we had, just to highlight what the public needs to do. We, about 14 or so days ago, we had a patient that came to us. And even just as soon as the statement was made that we have a positive COVID case in Kenya, we went in terms of training our staff, in terms of how to screen patients, because if you look at our catchment area, it's in the western side of Kenya around the Lake Region Economic Block, which stretches across many counties, across Bungoma, Busia, Siaya, Kakamega, all those. So given that understanding, we knew our population is at risk, so we initiated the steps of screening. So a young man presented to us. The only symptom was fever, okay? But given the screening that we had set in, it required that we probe, why he was having this. But again, given the stigma that is already there about quarantine, he proceeded to, to conceal his history of travel. And I think that one thing that complicates, or rather complicated that case, is that he was also positive for malaria.
Okay.
So it's very easy for you as a healthcare practitioner to treat the malaria as the cause of the fever. And forget that you need to screen properly.
Okay.
And indeed, when we, probed him further, he accepted that he was a returning citizen from a high burden country in Europe and transitioned through the UAE into Kenya.
Okay.
So again, given the guidelines that the Ministry of Health has provided, we isolated the, the patient. And then in communication with the, the government machinery, it was best that the patient be referred to Mbagathi for testing. And it was actually found that this patient was positive for COVID. So this then tells you that it's a complex affair we are dealing with. Like you rightly said, you may have patients who are symptomatic, but have others who are asymptomatic. So then it calls for health education and health-seeking behavior in the population, because it's been described that if it's mild symptoms, then for you not to overburden the system and for you not to, to reduce the chances of spreading, stay at home, call the GOK toll-free number. In the event that you're symptomatic or you're overwhelmed by the disease, when you present yourself to a healthcare facility, disclose all information that you require, so that then the health facilities are able to assist you accordingly as per the guidelines. So that's why I was saying public health interventions are never complex. It's just us going back to the basics and sticking to them. And I like the opportunity that this crisis presents, because it's an opportunity for us to go back and review our, our health system.
More or less a gift from God.
It's a gift from God, hoping that, we will not have mortalities around this. But it's a gift in the sense that we can go back and review what is the level of engagement that we can have from the private sector players like life care hospitals and the government, because our system is usually structured in line with the Kenya Essential Package for Health.
Okay.
You have the community, which is the most important player. Then as you rise up, you have primary care facilities, you have secondary care facilities, and then tertiary care facilities. So in terms of intervening, we need to know which are the right interventions to put at the community level, which are the right interventions like isolation facilities to put at the secondary level.
Okay.
And then now when we're discussing the issues of ICU and other, if you may, more complicated interventions, this can be at the tertiary level.
All right.
So we cannot invert the pyramid and start talking about ICUs when we've not addressed the issues in the community.
At the primary level.
At the primary level.
Which is, okay, go ahead please, just finish up, yes.
And that's the most important entry point, the community.
Okay, well noted, because that is the point with which when scholars in the field of medicine are trying to analyze European continent, which is largely the epicenter, accounts for 20,000 of the total more than 40,000 cases across the globe. And they took two case scenarios, Germany and Italy. Germany with a healthcare system more or less as developed as Italy, but the primary has been founded on solid ground to the extent that the cases are now less, unlike Italy, which is still in Europe, but is unable to cope with the numbers that continue to grow. All right, well noted point. Dr. Juma, if I may come to you. Many Kenyans see the coronavirus pandemic as more or less an April issue. By the end of April, all will be well, people will be going back to their jobs, that the economy will run up from the dust, will shake off the dust and will be all okay. But what happens in the event, it goes beyond April. And as hinted by the minister, the option of total lockdown on the table.
Yes, so
what next?
So yesterday, even when Uhuru presented a patient who recovered, they thought it was April Fool's And actually, Kenyans have really busted the whole issue, which I do advise them, because we can't afford to actually pierce the boat that we are on. We can all think this is the moment when we really needed to work together with the government, and make sure that we put measures, because it is a collective responsibility. It begins with an individual, communally, then all the way to the government. And where we castigate the government is when the government is focusing majorly on reactive measures, looking for where they hear a case, like in your case, and they drum it loud and use it to instill fear. Whereas there are certain preactive measures that individuals can take on their own individual basis. Like in a community where I come from, you'll find we'll try our best to make sure that our soldiers have all the gears. We fumigate our estate, and we make sure that our children, what we're working on right now is to see if we can get a tester so that we eliminate from our midst if there's any eventuality, the way you're saying. Because if people would be empowered through Nyumba Kumi initiative down to the grassroots and eliminate any threat that is among us, I think that's the approach Israelis are taking right now. They are moving very quick. to do the test on the grassroots and eliminate all the victims, lock them or quarantine them, and release the other healthy people back to the economy. And the challenges we are having, because there are too many paradoxes around this thing, even as we're talking about it, Ayub. You're talking about a lockdown.
Okay.
Actually, this lockdown is causing mayhem compared even to the corona itself. So as a government, what mitigative measures do you should you put in place to address this?
Correct.
Because the remedy of lockdown actually might end up or lead to spreading or more effective infection. You saw the things that are happening in Likoni. Police just crowd people and beat people. And what will be the result? And some Kenyans, because of the shortfall, actually some people have been chased out of their jobs. What mechanism? What else are they left to do? You'll still find them crowding, trying to get bread. So if we were sound enough or sane, I like his approach. We could have begun from the bottom of the pyramid.
Bottom up.
Yes,
correct.
Meet these individuals. Then inspire. Actually, this is where inspiration comes in.
Correct.
Tell them that we can do it together. It is we need unity along this thing, and then take these other measures that are necessary. They're telling us about ICU. Who wants to hear about ICU? We don't want to get there.
All right.
You're telling us, all these things you're talking about. If anything, none of us want to get there. So these are the levels of engagements which actually they would have been projecting out, and that way you would be containing anxiety, and also because some will definitely go to drink it out, and where they drink it out, you spread it further. So we support the government. We are not talking negatively about the government, but it is a test on their leadership. The leadership quality needs to come out, because Ayub, the way we handle this thing can be historical. Our next generation can learn from us how we handle crisis.
All right.
And we don't have to necessarily do it the way US is doing it. We are also unique as a country. This is the moment when we bring ourselves, our uniqueness out. And we have experts. We have actually, top-notch who are even best in the world. Put them to use. But if we continue propagating this incompetence that actually have always taken us down the drain, then yes, we'll speak out.
Well, there are cases of complete incompetency in the country in regards to, of course, the trust issue which comes with the aspect of the coronavirus pandemic, because at some point it was the same government that said there were no deaths in Turkana in early 2019 when there were deaths as per, of course, the government's communication. And then you have such information coming acknowledging that by end of April this month, we are likely going to be having 10,000 cases. Now, the Mwananchi seems to be torn between who to trust now, because the same government lied about some numbers, and then the same government tells you we are likely going to be having 10,000 cases by end of April, and how that mathematically will be achieved in the next 28 days, because there has to be an increase of not less than 500 cases at some point if we are to hit the 10,000 mark. But Professor and Daktari, I'll come to you after the break here on the program. We continue with the discussion here on Mid-Morning New Day Kenya, and they will be unpacking the aspect of the lockdown and what can be done prior that. We know that it's an option on the table, but the government must address the economic issues, the disparities laid bare that continues to, of course, upsurge in regard to the continuous growing gap between the poor and the rich in the country, and whether we can get an understanding and assessment to our viewers back at home to get an understanding equally as to the lockdown and what will happen in the event that transpires in the country. The number is 0791 478 990, the hashtag on Twitter is NewDayKE. The short SMS code is 40920. Stay up. Equally, we'll be doing the international update after the break here on the program. Welcome back. You're watching the broadcast, and thank you for keeping to stay with us and keeping us company here on the program. The number is 0791 478 990. The hashtag on Twitter is NewDayKE. The short SMS code is 40920. Now, members of parliament from the National Assembly are expected to hold a special sitting on Wednesday next week to discuss the weighty matters in relation to the coronavirus pandemic in the country. Speaker of the House, Justin Muturi, has ordered members of parliament to reconvene following a request by the majority leader and Garissa Township Member of Parliament, Adan Duale, to legislators, and among the others, cushioning Kenyans from the economic crisis caused by the pandemic. Our reporter, Jeff Khaimba, has the details of that story.
Just a day after the Senate held its special sitting to discuss measures meant to combat the deadly coronavirus pandemic, members of the National Assembly have thrown their weight behind the move by organizing their own sitting. Following a request by the majority leader in the Assembly, Eden Duale, to the Speaker of the National Assembly, Justin Muturi, the members of the Parliament will hold a special sitting on Wednesday, April 8th, 2020, from 10 a.m.
Either the leader of the majority party or the leader of the minority party to write to either Speaker requesting for a special sitting or a recall of the House or any of the houses to debate or deliberate on a specific stated business.
Top on the agenda of the discussion will include a laying of various instruments relating to the COVID-19 pandemic, which comprises the public finance management involving COVID-19 emergency response fund regulations of 2020. The members of the Parliament will also consider at all stages of the Tax Laws Amendment Bill of 2020, which contains part of the legislative measures to address the taxation regime occasioned by the COVID-19 pandemic. The other matters on the floor of the House will involve legislation of any measures to caution the country from the effects of the COVID-19. Already a majority of the Kenyans are crying of the hard economic times occasioned by a dusk to dawn curfew.
But it is my expectation, as we sat with my brother, we also said we hope that the National Treasury will be coming up with a mechanism of where those resources are going to be channeled to. Remember, if it is a fund, it is the Cabinet Secretary for National Treasury who has constitutional mandate and also under the PFM Act to set up a fund. The COVID-19 pandemic is one that is of great moment in the country and indeed in the whole world.
The plans for a special sitting by the National Assembly come after the Senate deliberated several matters during their Tuesday special sitting.
Wanted to approach that cabinet secretary to be more than willing for us.
The senators agreed to contribute 200 million Kenyan shillings towards the fight against the coronavirus pandemic in Kenya. A statement from the Speaker, Kenneth Lusaka, said a number of the measures have been taken by the various levels of the government and various state officers.
Arising from the pandemic, the Senate resolves to 1. Laud the national government for the measures it has so far put in place in combating the spread of the virus. B. Commend and appreciate all healthcare workers in the country for their selfless effort, commitment to service, care and compassion towards persons who have been infected or affected by the virus.
The Speaker requested the Parliamentary Service Commission to take the necessary administrative measures to yield the stated sum from the budget of the Senate to the National Treasury.
Note that the plenary and committee sittings are being held after consultation.
So far, Kenya has reported 59 cases of the novel coronavirus, 1 death and 1 recovery. The Senate announcement comes on the backdrop of President Uhuru Kenyatta's directive for the Treasury to establish the COVID-19 Emergency Response Fund. Reporting for Ebro TV, I'm Jeff Khaemba.
As in the report indicated by Jeff Khaemba voiced, the number is 81, not 59, and we apologize for that. The total confirmed cases in the country so far are 81. And not 59, as voiced in that story by our political affairs reporter, Jeff Khaemba. Professor, if I may come to you, special sitting, Senate so far sat, the National Assembly next week on Wednesday, and this comes at a time of crisis when the leadership of the country needs to stand up to the test of time. We have seen the United Kingdom government bailing out its people £2,500 to all the citizens, 80% of the workforce in that country. And generally, their affairs are good in social welfare states, especially in the European continent. In the event we are going for a lockdown, we are in the midst of a curfew already. Kenyans are complaining because of the timing and reaching home, and all that at the center is police brutality, and Kenyans are complaining. Therefore, how do we do all this with the correct amount of resourcing and the good political will in the country?
Yes, no, thank you for this. And Dr. here had highlighted that we need to go back to first principles. We should not just do lockdown because people are doing lockdown. The fundamental bit that we must actually ask ourselves, the basic questions. What is this disease? Do we understand it? How does it spread? And how can that be
Okay,
dealt with?
the second bit, you'll continue. Let me pick this call from home, and then you'll continue.
No problem.
Kelvin calling us from the county of Eldoret in Uasin Gishu County. Good afternoon, Kelvin.
Good afternoon to I.
Afternoon to you. Habari ya Eldoret?
Okay, I've been Vihiga.
Yes, Vihiga. Okay, I'm sorry, Vihiga County. Yes.
Now I wanted to say something. Now looking at the statistics, Nairobi is leading. So I wanted to propose that if the government is listening to us, there are total lockdown in Nairobi zone.
Okay.
But now they supply to the Nairobians.
Yes.
For those ones who are having hand to mouth. So, for example, now I'm in the village. Now most of the people I can see are coming from Nairobi to the village. No, that's like they're spreading the virus. The government can do something. They lock down Nairobi County alone. Now, then other counties no more. I think that will help. Yes.
Okay.
Then I wanted to ask you, the professor, what happens if the exams are cancelled? The KCC and the KCC exams are cancelled.
All right.
I'm asking automatic.
All right. Thank you so much. That is Kelvin calling us from the county of Vihiga. Of course, he's posing a question to you equally. Right. What happens when we call of the Kenya National Examination Council examinations, that is the Kenya Certificate of Primary Education and Secondary Education? We'll respond to that. And as per, of course, the request put forth by Kopet, but continue with your point as you finish up.
Yes, I think it's important to understand the structure of our population and then design something that is specific to that particular structure. What do I mean? If you look at Kenya generally, about 70% of the population are involved in small-scale businesses. They don't have long-term savings. They're people who work on a day-to-day basis. I'll give you a case of a contradictory case that was highlighted the other day to tell you that some of these measures need to be thought a lot more. About this woman who sells fish. And people need fish during this time.
Yes.
Because we are not getting our fish from China. And the lady was saying, look here, fish, you can only catch fish at night. That is when fishermen catch fish. So if you put a curfew, it means you can't catch fish. And you know, you need to get that fish and prepare it so that it gets into the market during the day.
Okay.
So if you tell this person that no problem, just bring your fish to the market during the day, but ensure you're at home from 7 to 5 a.m., it basically means you're killing that. So the thinking is this, that we need to critically look at the structure of our economy, see what sort of support government can actually give, and then design response measures that are very, very specific to our economy, and they're doable. I'll highlight cases in Europe, for example. Sweden, for example, has no lockdown. How come Sweden has no lockdown? Sweden is a very unique country in Europe. They say an average Swede has a policeman in his head. What does this mean? An average Swede follows the law. As long as he has the information, he will actually do what he's been told to do. So you don't need a lockdown. You just need to tell the Swede, stay at home, and they'll actually stay at home. You need to tell the Swede, don't use public transport. They will not use public transport and so on. So that's what I'm saying. If you look at Italy, Italy is very different. You may actually need a lockdown. Yes. So in all these scenarios, what we should be looking at is to say, okay, fine. If we are going to have a lockdown, what does it actually mean? It means that this person who feeds themselves on a daily basis has to be fed. And is government thinking about that?
Okay.
A situation where 45 million Kenyans will to be fed. And like our Eldoret friend is actually saying, can we, for example, have some intensified measures in some places and not other places? Look at the contradiction linked to the schools. When the schools were shut down, somebody told me that, oh, why is government shutting down schools and schools happen to be the safe places? I was saying, no, schools are enclosed places. So if one person goes there with the sickness, it'll spread to everybody. Why am I using that? If you shut down a big informal settlement with high contact, you might actually be worsening the problem. If you have a couple of cases in there,
okay,
you are going to spread the virus a lot more rapidly than, you know, in a situation where there was no shutdown. So my point is that we really need to look at our situation, the structure of our economy, and understand the nature of the disease, and then actually create a response. And this response cannot be generic. It definitely cannot be generic. What will work in Nairobi is not the same thing that will work in Turkana and so on.
Okay, given that, you'll respond to the question before I come to the Daktari, and to what will happen to the Kenya Certificate of Primary and Secondary Education Examinations. But before that, and to your point, you pointed out that we need to understand our economy, how it works, the structure, the modeling, and come up with or tailor measures or mechanisms or solutions for our own problems, meaning we must address our domestic affairs. Is that a policy the government is considering, or we are just chest thumping into some of these issues without considerations for how our economy performs?
We know exactly what government is doing. Government has put a COVID response team, and you can tell the COVID response team is dominated by the big corporate, by Safaricom, by KCB,
Equity Bank.
by Equity Bank, but is Kenya corporatized, put differently? Are Kenyans within that particular sector? Do these guys actually represent or even understand the reality of the Kenyan economy? They don't. The truth of the matter is that the corporate sector, even you know, in terms of participation, is less than 30%. A lot of people are in these small-scale, informal things and so on. And how is government, for example, responding to that? But having said that, it's not like government didn't know how to deal with this thing. For many years, we've always had provincial administration. We've always had chiefs. We've always had, you know, DOs and DCs, even headmen in the village. And these have been used before for the reasons to actually be able to manage and control the populations. What is my point? The point I'm actually trying to say is that even currently, as it were in Kenya, we actually do have systems and structures that can be activated, that can have a more effective response than corporatized response that is more relevant to developed countries, where everybody, literally everybody is in the corporate sector, where I'll order pizza online and is dropped at
your doorstep.
At my doorstep. Where will you order pizza online in Samburu or in Siaya? In fact, there is even no pizza people there in the first instance. Yeah. So my point is that we are not really taking advantage of whom we are and the structure of our economy and things that we can actually unlock. Even the basic hygiene things. Those things, by the way, for many years, basic hygiene in this country, including issues of sanitation, was enforced by headmen in the village. It was never enforced by some bigwig sitting at national level. So my point is that we need to actually start looking at our situation as a unique situation, and then starting to play on our strengths, as opposed to doing this cut and paste.
All right. Dr. if I may come to you then. Kevin did talk about the concern that many in the counties or across the devolved units have in terms of people who are coming back from Nairobi and into the counties. For instance, Nairobi is popular, so is Mombasa County, so is Kakamega County. But when one moves from Nairobi County, and you pointed out this in one of your pieces that you have written in terms of your analysis of the situation, and then goes to Bungoma, a populous county, or Kisumu, which is also a populous county, what happens then? Are we not risking the situation, and how will the government effect in terms of, or effect changes in terms of curbing this transport and the sort of urban to rural migration?
Yeah, thank you. I think I entirely agree with Prof that you can never copy-paste strategies, because in healthcare systems, there's healthcare follows the pathway called complex adaptive systems. This means that for every country or for every healthcare systems, depending on how the different ingredients play, then you have certain outcomes. So you can never copy-paste a strategy that is being used in the US and impose it on Kenya. Because again, if you compare, say, US and Italy, you're seeing in the US they're having twice as many cases as Italy, but Italy is having twice as many mortalities as the US. When you look at a country like Uganda, they never delayed. Once they saw the potential entry of COVID, they locked their borders. So you must understand, for example, why did Uganda do that? you know, Uganda has had an experience with epidemics, whether it's Ebola, Marburg, nodding disease. So their response will not be the same as Kenya. So when you come to Kenya then, and because we have a tool called heat maps, you can map the country, and as it is right now, we know that Nairobi is the epicenter. So you can then point and say Nairobi is a hot area, okay? And again, when you look at county setup, county has subdivisions. You have sub-counties, you have wards, you have enumeration areas. So you can,
in every ward you have an administrator.
You can, villages, household, nyumba kumis. So the folks at the IDSR, which is the unit in the Ministry of Health that do surveillance, they can actually map this out and see which are the hot areas in the country. They now proceed and see, do we need increased surveillance? Do we need to lock this area? And even as we lock, what does that mean for the common people? So you can never just declare that since Italy is locking, then Kenya we also
There must
locking.
be certain aspect of
There must be some science behind the decisions that you're making. And on the question of urban to rural migration, if you look at these countries that have very high mortalities, there's what is called the epidemiological transition curve, where with time, infectious diseases have been dropping, and then non-infectious have been increasing. Due to improved healthcare, populations have been aging. So in these countries that are having a high mortality, they are having an aged population. With an aged population, you have immunosuppression. So if the disease strikes you, then your chances of dying are higher. If you look at a country like Kenya, most of our aged population are retirees. So they are in the villages. So if COVID was to strike the villages, they are most at risk in terms of mortalities. And this would push our mortalities from the one that we have to higher. So then that's why the Ministry of Health was advising people that we should stop this movement from the urban areas to the rural areas, because then this puts the rural areas at risk. And again, the government is able to have a look and see which are the paths that this migration is occurring.
Okay.
And then simply intervene and stop that.
All right. And I'll equally be taking a look at whether this sort of movements at our Kenyan context level is equally across the globe, where we have lockdowns, no air travels, for instance, no European plane can touch down in the United States of America, and whether globalization has been affected. I'll come to Dr. Ari in regards to that, but first this story that is equally of importance. Vegetable and fruits farmers in Naivasha, Nakuru County are staring at a closure of their farms following the coronavirus pandemic that has seen cargo flights to various European countries suspended. Already 50% of the workers have been sent home by companies, with fears that the numbers could rise in the coming days in the country as the pandemic continues to affect more countries in Africa and across the globe.
The coronavirus pandemic continues to hit businesses hard. Exports have dropped by 50%, while flight charges have tripled in the last 1 month due to a shortage of cargo planes. According to Edward Mureu, the proprietor of Naivasha-based Ruby branch, the country is staring at hunger and major job losses in the coming months. Mureu notes that Kenya Airways and British Airways had cancelled their flight to the EU, leading to a crisis in exporting their products. Speaking during a tour of his farm, Mureu knows that already he had been forced to send some 50% of his workforce, meaning a drop in their production.
Kufunga kwa madege kwenda Ulaya iko na hasara kubwa sana, kwa sababu tulikuwa tunategemea ndege za British Airways na Kenya Airways wamefunga.
The farmer, who deals with French beans, broccoli, baby corn, among other produce, called on the government to zero-rate farm inputs and lower the cost of electricity tariffs.
Kazi kwa shamba imepungua, kwa sababu kama tulikuwa tunatoa kama ni tani 10 kwa siku, imepungua karibu nusu.
One of the workers, Fanis Nasimiu, says that the disease had raised fear and anxiety among the workers who had no other source of livelihood.
Tukisikia kwa radio, kwa TV kwamba watu wanaendelea kukufa, tunakuwa na hofu kubwa sana. Tuko na hofu kwa sababu wanaweza tusimamisha kazi.
Tulikuwa tunasafiri tukiwa 260, sasa tunakuja 30. Tunapewa break kwa magroups. Mna break nusu kwa wiki moja, wengine wanarudi kazi hivyo ili kila mtu apate riziki yake ya kila siku.
Speaking earlier, the CEO for Agricultural Employers Association Wesley Siele noted that the drop in the exports had been contributed by the limited movement of consumers in Europe. Siele said that supermarkets mainly in the UK, Sweden and Russia were still ordering fresh produce from the country, though getting cargo flights was the main challenge. Busara Naman for Ebru TV.
Dr. Juma, I was on you before we took this story that pertains to Naivasha farm flowers who have been impacted because the European market is shut. We're seeing border closures and no more crossing from France, say, to Belgium or from Italy to Spain. And that equally is having a dreadful impact on the global economy. Then at what point will the government then here inject some aspect of liquid into the economy, as per, of course, the guidelines and the measures so far issued by the Central Bank of Kenya Governor, Dr. Patrick Njuguna?
A number of requisite measures are required at this moment. They have to be logical and, if possible, also be legal, even as we address the situation. But of course, Kenyans also need to understand that we are dealing with a pandemic, and it's a case of life and death, because if it's not well handled, then we can go down in history that we lost so many lives on measures that we could have taken. And when it comes to your life...
Yes, Doctor, let me just pause you. Allow me to take this call.
Go ahead.
And this is Wycliffe Simiyu calling us from Kitale. Good afternoon.
Good afternoon. Can you fix me? I want to make a discussion on the screen that is going on.
Okay, go ahead, please. Yes,
thank you very much for the discussion you are doing.
Kindly, if you can listen,
thank the government for what it is doing.
Wycliffe, kindly, if you can lessen the volume of your television set so that we can have effective communication. Tafadhali.
The volume of the...
Yes, go ahead, please. Yes, if you can lessen the volume, then we can continue.
Okay, this is what I want to say. May I thank the government for what it's doing?
Okay.
And my proposal is this.
Yes, we'll continue, and we call on our viewers from home to lessen the volume of their television set so that we can have effective communication line or channel, and to understand the context. And of course, we cherish your input and contribution here on the program. The numbers displayed on the bottom end of your screen is 0791478990. Yes, Doctor, go ahead, please.
Yes, in the cases that we actually all should be united to actually, embrace, the government ought to have given some relief, especially to the citizens, where more so on these ones who are feeding from hand to mouth, because the individuals who actually they earn daily and they eat daily, and that's how they pay their rent as well. So the moment you stop just one day, that person will be, or that family will be in a crisis. And those are areas where the government ought to have actually moved in quick to arrest the spread, because indeed some people will not stay at home, like the flower workers. These are guys who are probably being paid weekly, some are paid daily. So when they are not earning, what else do we expect them to do? And we had advised the government, this is the moment, even globally, actually the fuel prices have gone down. And here we are still actually buying fuel at an exorbitant price,
no
which is not making sense. So lower the fuel price. That way, even the matatu guy who is operating there can ethically reduce the fares, which is actually also going to be a relief on the end user, because it's the citizens who are using these things. Alternatively, they'll be crowded walking on the road, and whatever happens in those areas, you cannot control. And there are other various mitigative measures. Empower the police and let the police act legally. Do not go there clobbering the innocent citizen and actually to death. Why would you be more cruel than even the virus itself?
and kill more people than the virus?
That's so far, those are the statistics we're having. So let everyone act within the law, and the measures be measures that actually yes, will not take you back to court, because they'll haunt you later.
Correct.
And we've already seen LSK going to court. So, and with the doctors, give them the right gear. Equip the doctors so that when they are actually, in this case, our soldiers are the doctors.
Yes.
Arm them well and empower the best. When you put mediocres there, instead of exalting merit, because there's a moment when we need our best arsenal outside. And then when it comes to food concession, there are a number of provisions. Actually, we don't need charity. Within our local mechanism, right now, milk in Nakuru, some factories are just taking half of what is being delivered. So we need to think creatively and see how these people can buy more milk. There are people who are producing maize, and those maize are not being bought. The government can chip in, and even the silos, we have NCPB.
Yes.
This is the moment when you're offering the silos and then provide. These are very simple measures. And then people will actually, as you're saying, talking about Sweden, because the best law actually in the world is a self-enforced law. The moment you compel a human being to follow a law, definitely they'll rebel even if the law was good. So that way, if somebody is full, because with an empty stomach, even if you are a professor, you want to think straight.
All right.
So if you can calm them down to that level, then invite them collectively now to see how to battle this thing and fight it, so that our case and our study become unique, become different, and we can assure our people that we are working together. And on education, I think also is a challenge as well. Some of us have said that education necessarily does not have to be examined. Sometimes it can be designed, and these are the questions people are asking now.
Correct.
Why are our doctors not coming with the cures? Why are they sitting back waiting for the US to come up with vaccines?
All the attention on the doctors now.
Exactly.
Okay.
So, yes. And yes, they passed very well. We have very good papers. So what went wrong with our education system? So these are the questions. They are very serious questions we need to ask ourselves.
All right.
So that should inform how we educate our people.
Exactly.
And that actually, right now, we should be focusing more on researchers, empower researchers, isn't it?
Correct.
Yeah, equip equip our people more on innovation. We need to make these aerators down here. It's a business opportunity for us. The mask, why are you going to import the mask in China?
All right.
Yet we have NYS.
The capacity to manufacture.
Exactly.
And of course, we are self-making our own uniforms.
Yeah, so it's an opportunity that can be explored in various dimensions.
Okay, and Africa, according to some experts, the likes of Dr. and company in his fraternity have said that Africa had a wiggle room, some headroom before the crisis hit home, and therefore have some capacity to show the world that they can withstand and develop that muscle. But Professor, if I may come to you, a lot to talk about because these are so extensive, debate. But in regard to what's happening at the moment, Africa trades with China more than it trades with itself. There is no intra-trade among the Africans than the inter-trade with China. $200 billion US is what I'm talking about in terms of the trade deal between Beijing and the African continent. But when you look at that, at the Kenyan context, when we cascade that down to Nairobi level, do you feel that the president, who is the head of state, has a steady hand on the steering wheel in the country? And is he a little bit upfront, as is the case with Angela Merkel in Germany, who said, to be fair with you Germans, 60 to 70% of us will be infected. So was Boris Johnson, who said, this is the worst crisis in a generation in the UK. And unlike Donald Trump, refrain from calling it a Chinese virus or misjudging the situation, as was the case in Italy.
Right. In fact, I liked the reference of this disease to war. Yeah, because that's the situation we're in. But then, if you look at it, this also called for leadership at all levels. It's demonstrated, first and foremost, that we don't have global leadership. How do you behave in a situation of war, honestly? Is a situation like Dr. was saying here, is a matter of life and death. In a matter of life and death, do you still ask your neighbor that, okay, fine, you lent me your goat last year, and I think I'll only pay 2 or 3 chicken. At that point, that is immaterial. In fact, you tell your neighbor, sorry, we'll come back to this after the war is over.
Yes.
What do I mean? What I mean is that when I see the way our leaders are responding to this, of course, Kenya, before even worrying about the disease, we already had some other diseases. One of them is Chinese loans. And I mean, when this hit us, we only had 2.8 billion in treasury. Really? Well, that broke. The governor's central bank had to release 78 billion straight away into the economy and so on. We're already down on our knees. And what would I expect of the command of the armed forces of the Republic of Kenya is first and foremost to say, look here, we are in a war situation. The most critical thing is that we must protect our people. That is a fundamental thing. And everything else then becomes secondary. Then it means that anything that is going to undermine our ability to protect our people, we must engage with it. And part of it is China and the Chinese loans and the Chinese trade and so on. And I would expect that already the conversations of how some of these things can be deferred. The bad decisions in the first instance, but we need to defer them now because we cannot afford to pay China and protect our people at the same time. It's just not possible. We really are down on our knees. And then on the other hand, and that's what I've been emphasizing. How then do we protect our people? Where is the problem, that we're dealing with here? Okay. Number one, we have a supply problem because our economy literally relies hugely on export. But I'm not even worried about that. What I'm more worried about is the demand. Our demand is collapsing because as long as people are not spending, as long as people are at home, as long as people are not earning money and so on, then in fact even those goods and services, they will not actually be taken up. So government has to clearly think that, okay, fine, I mean, how do we ensure that, for the little production that is there, that is needed, by the way. You think of this bizarre situation where you need food, and there's food, and you can't afford it. So government needs to think, how do we support demand? Because this demand cannot collapse. What Mureo was talking about in Naivasha there, these people need some money because without that money, they cannot survive. And when they can't work, they can't get that money. So government needs to start thinking about these big chunks. How do we deal with our debt situation? Number two, how do we deal with our supply situations from a global economics perspective? Number three, how do we ensure that there's some minimal demand so that these things that are needed, the industry don't close down because we need the milk.
All right.
Now you can imagine if you're not producing milk because we cannot buy. Eventually we raid your industry and the industry collapses and your potential to produce, even when things stabilize, disappears. Yeah, so I want to see a little bit more nuanced and a broader response than simply saying, okay, fine, let's reduce VAT to 14% is good, is actually appreciated and so on. But government needs to think, these big chunks, we need to think about them. What does this mean for us in terms of our debt as a country? What does it mean for us in terms of supply chains that have been disrupted globally and locally? And what does it mean for us in terms of just people being able to afford what they need on a day-to-day basis?
Okay, Dr. at the center. I mean, this is an extended crisis for an unprecedented time, and we are in the midst of the calamity. Can we withstand? Can we develop that muscle? And post-COVID-19, are there lessons we can learn to boost and revamp our healthcare systems in the country for Kenyans to be covered universally?
That's a really good question. And if you look at the concept of universal health coverage, one measure is usually how resilient your health system is. And resilience basically means the ability to bounce back after adversity. So, like I said initially, this is a blessing in disguise, because with this we can go back to the basics, that even as we respond to the pandemic, you have public sector players, you have private sector players. How do they lock each other and move forward in managing this? And as you stratify your strategies, what are you going to do at the community, secondary level, tertiary level, and so forth? So I'd say this is a blessing in disguise. And one thing we must do is that we must use the worst case scenario to plan. A lot of Kenyans are thinking this is an April affair and it will end. The hard truth is that it's not an end of April affair. Because if you look at epidemics and pandemics, you usually need a period wherein you do not have new cases for the World Health Organization to say that now the pandemic is over. And if you look at COVID, the maximum incubation period is 14 days. So if you double that up, that becomes 28, which is almost a month. So you will need at least a month of no new cases globally for you now to declare the pandemic as over. And again, not just the 1 month, you also need about 60 to 90 days of active surveillance for you to really say that there are no new cases emerging.
Okay.
Because the risk with declaring a pandemic or epidemic over early is that you can have a flare of new cases. Then now you go back to square one. So we really must plan with the worst case scenario, even as Kenya, so that then we learn from these lessons, respond adequately, and move forward with it.
All right. Yes, Dr. Your final comments?
Yes, it's a very interesting moment, and I agree with you. Measures must be taken, and serious measures. And ordinary times call for extraordinary measures. And that's exactly what Kenyans should be ready for. And I would appeal to those who feel isolated, those who feel the pain, those who have lost loved ones. Let them not feel that they are alone. We are all together in this. And the best that we can do are those who have the means to help to quicken and hasten the means of how to reach out. And in the meantime, we take the guidelines that we've been given and wash your hands. It's very easy, isn't it? And keep distance. I know that might be a bit difficult. And yes, with the right mask, because I'm told the mask that you might need might be the lower one, the cheaper one. And
you have gotten it?
Yes, yes. Because as it stands, we can manage this thing. And something about us Kenyans, we are always unique in our own way.
Right.
And our resilience, now we can come out of this. We've gone through so many things. If you look at our political leadership, if we can withstand that.
All right.
So we can stand and withstand a lot, and I'm certain we will come out of this victoriously. We need to hold our hands together and support the mechanisms that there be. But let the government also play its role. Issues to do with the bills, the rents, the loans, the taxes, those ones the government can chip in to mitigate. We proposed yesterday that landlords should make measures to help them give ease to the renters.
Okay.
If possible, let the renters not pay rent for this period. And the government should lead in that. If they don't, we'll come out and tell the renters not to pay rent.
All right. Thank you so much, Dr. Justus Juma, the leader, Justice and Freedom Party in the country. I appreciate your time. At the center is Dr. Kevin Rombosio. Thank you so much. I appreciate your time. Always appreciated. And Professor Alfred Omenya, I appreciate your time. Thank you so much, gentlemen, for coming on board and informing Kenyans at this hour of need in regard to your expert analysis. So we take a look at the highlights from the international scene and what we have so far from the touch screen in regard to the coronavirus pandemic across the globe. So far, we are less by about 63,000 cases to hit 1 million mark across the globe. 937,783 is the total confirmed number of cases as per the tracking done by the Johns Hopkins University. Total deaths across the country, 47,261. And the countries or the regions affected are 180. So when you come here, you have the heat map across the globe. So far, no area is safe from the coronavirus pandemic. The entire globe is affected at one point or the other in regard to the cases so far reported. Now, there seems to be some walk away from the attention, walk away from China to the United States of America, which so far has the highest number across the globe now, followed by Italy, which is the most affected country in terms of the number of deaths recorded by the World Health Organization. And therefore, this is the geographic outlook equally captured by the Center for System Science and Engineering at Johns Hopkins University. Now, next to when you go is another important element as to the graphic representations that we have will be showing up shortly on your screens here. And if I may go to the cases that we have in terms of the total confirmed number of cases in the United States of America. This is the affected country, most affected country, and only New York you have 2,220 cases, New Jersey 355, California, Michigan, Florida, Massachusetts, Illinois, Louisiana, Pennsylvania, Washington, Georgia, Texas, and Colorado, Tennessee, Indiana, Ohio, Maryland, North Carolina, some of the affected countries, states in the United States of America. This is the area I want to refresh in regard to the airspace, how it's looking like across the globe. No airline is moving from the European continent across the North Atlantic Ocean to the United States of America. But there seems to be the airline, especially in the United States of America level, low air activity in Latin America, South America, or in Africa, and in Africa rather. And in Australia, you can see how the concentration is in regards to what's transpiring between Sydney, Papua New Guinea, and other cities of Melbourne in Australia. But Europe appears to be busy in terms of its airline, and you can see how there are, of course, flights between Sweden, Finland, Norway, Ukraine, Kazakhstan, Russia. You have equally in Poland, in the United Kingdom, Portugal, but these are done with concerns as to the measures put in place by the World Health Organization. Now, these are the numbers done by the BBC, if we can have this up on air, and this was from the 22nd of January to the 27th of March last week, in the month that ended, and so far you can see how China at this time had 548 cases, Japan had 2, Thailand 2, South Korea 1, Taiwan 1, the United States, which has more than 200,000 cases, had 1 at the time, Afghanistan, Albania, Algeria, Andorra had 0 cases. So when I play, you can see how it changes, and this number significantly changes, and China now tops until the United States will be overtaking Japan, coming up and then going down following the misjudged Diamond Princess ship which was to dock at the port city of Yokohama. Germany all coming up, and you can see that by the end here you will be having 900, not less than 900,000 cases. And this is, of course, the concern that the World Health Organization has been expressing in regard to the coronavirus pandemic and how this has significantly affected the global economy with regards to the shutting down of borders. And you can see how the timeline is now so speedy. And then you have 905 cases by the end of the 27th of March last week. The US now with all those cases that you have seen. Let me just fast forward this and pause so that we can have the final numbers here. America with 200,000. This was updated some minutes ago as per the tracking done by Johns Hopkins University. Come to the CNN, and this is playing this how the world was safe here, and you can see how the fast spreading pandemic has taken over the world. You can see how all these areas will be red shaded. At one point, the most affected country will be the United States of America, and this is from the CNN Health, of course, section of its website, and this is now an entirely a global affair. Al Jazeera equally covered, and the cases of COVID-19 cases, you can have Kenya, 81 confirmed cases, 1 death. Clicking on Russia, you have 2,777 cases, 24 recorded deaths. America is now the epicenter. 213 cases and 4,757 deaths. And you can go to the United States of America still for 4,757 deaths. And when you click on Brazil, 6,836 cases, 240 deaths. Australia, you have 4,862 confirmed cases, 20 deaths. And you click on Sudan or Egypt, 779 cases, 52 deaths in that country, though there are concerns as to, of course, the draconian measures put in place by President Abdel Fattah el-Sisi's military junta, who came to power after deposing the then President Mohamed Morsi, who died in 2019. So we are ending the program here, mid-morning new day here on the program. The number has been 0791478990. The hashtag on Twitter is NewDayK. The short SMS code is 40920. In less than 10 minutes' time, Kenneth Kazungu is up next with Ebru News at 1. Later at 7 p.m., Busara Naman is up next with Mwanga wa Ebru, and tonight at Primetime News, I'll be on and up with the Primetime News, and equally News Compass will be talking to Professor James Julius Oyuge from the University of Nairobi Department of Microbiology as we seek the sentiment in regard to the medical response so far the government has deployed. So all here from us, we say thank you for choosing to stay with us, for keeping us company, for tuning in. We'll do it again from Monday next week by the grace of God. Stay at home, save life, protect our healthcare system. Good afternoon.